Hello friends, welcome to FastCoder 21 free medical coding YouTube channel. Today we are going to learn surgical pathology CBT coding episode 1. As all of us know, nowadays most of the companies are providing work from home job for the surgical pathology CPT coding. That's why in order to help the coders who are looking for permanent work from home jobs, I am trying to help the coders by providing few insights about surgical pathology CPT coding. If you are visiting for the first time, please subscribe on our channel. In order to get good idea about surgical pathology CPT coding, please watch this video until the end. As all of us know, whenever we code any type of operative report, physician will send biopsy sample to the surgical pathology. But all of us know every time we used to listen the word surgical pathology, but we don't know what is surgical pathology, and we need to understand that there is a coding for surgical pathology also. So in this episode we are going to learn few details about surgical pathology CPT coding, which you are going to use while you are coding surgical pathology or you are going for any type of interview. So what is pathology? Pathology is the study of disease. So whenever we send a sample to the pathology department, they will study the disease. Pathology contains diagnosing infections and pathologies of human body organs. So using the pathology, we will find the infections as well as the pathologies of any type of human body organ. For example, if the physician excises lipoma and he will send to the pathology, so their physician is going to find the pathological disease in the specimen. So next we will learn what is surgical pathology. So the name itself indicates surgical pathology is the study of tissue removed from living patients during surgery to help diagnose a disease and determine a treatment plan. So what happens during the surgery, physician will remove the biopsy sample or some type of tissues from the living patients, and they will send those samples to the surgical pathology department or pathology department. So what are included in surgical pathology? So whenever a physician send pathology report to the excised sample to the pathology, this pathology examination includes they will perform the physical exam with naked eye, and also they will use microscope in order to perform the complete examination of the tissue, and also they will perform other types of laboratory tests. So who is a pathologist? So pathologists also, like, they are also physicians. Basically, they are responsible for pathology and help diagnosis diseases. So whenever if the physician is a gastroenterologist, so if we send the samples to the pathology department, their pathologist will identify the reason for the sample, and he will find the disease organism in the sample. For example, if it is a mass, pathologist mainly will check for whether it is a benign neoplasm or whether it is a malignant neoplasm. So basically, pathologists diagnose the diseases by examining the tissue samples for signs of any illness or injury. So as a pathologist, their main input is tissue sample and their output is disease process they will find in the pathology sample. So in order to find disease process, pathologists generally use microscopes, blood tests, and DNA analysis. So basically, pathologist also a physician. So whenever we code ICD-10 CM coding from pathology reports, we need to code it as confirmed diagnosis, as pathologist also a physician. So next we will let common definitions in pathology and laboratory. So we have like quantitative, qualitative, gross examination and panel. So first we will learn about quantitative. So basically quantitative measurements quantify the amount of substance present in the system. So basically here the keyword is quantity. How much quantity is the substance present in the system? The common reasons for quantitative analysis is in order to find the cholesterol levels or in order to find the concentration of drug in the bloodstream. So using these quantitative measures, physician will identify what is the quantity of cholesterol or drug in the blood. So using the qualitative technique or measurements, physician will identify whether the suspected substance is present in the sample or not. So using the qualitative analysis or qualitative measurement, physician will identify the any type of drug in the system. So next one is cross examination. So basically cross examination is open examination. Here physician will not use any microscope or any other type of tools in order to examine the provided tissue. So next one is panel. So basically panel is a set of tests so that are conducted together to assess a person's overall health. So basically panel contains multiple number of tests. So in order to find the person's overall health, physician will perform panel testing. So in order to code the complete panel, we need to identify whether physician has performed all the panel tests or not. If more than one panel is tested along with another test, we need to code the another test separately along with the complete panel. So next we will learn different types of pathological labs. So basically there are various types of pathological labs. Generally we have histopathology, microbiology laboratory and molecular genetics laboratory. So what is histopathology? Study of tissue samples from a patient's body to look out for signs of disease or abnormality. So using the histopathology method, physician will study the samples from the patient's body to in order to find any signs of disease or any type of abnormality in the provided tissue. So next one is microbiology laboratory. So a lab where doctors can perform tests on bacteria or virus. So basically in microbiology laboratory, a physician will check any type of bacteria or any type of virus present in the provided sample or not. So and also they will determine if any infection is there or not. So common examples for microbiology laboratory are tuberculosis. Next one is molecular genetics laboratory. So where doctor test DNA. So basically using the DNA testing, physicians will identify any type of genetic mutation exists in our body. So the common reasons for molecular genetics laboratory is like for example cancers or Down syndrome conditions, physician will perform DNA testing. So next one is histopathology laboratory. So a medical facility where doctors can take samples from your body. As we have learned previously, it is a laboratory setting. Here physician will take the samples from your body and they will use microscope, any other types of instruments in order to find the cancer. The input for histopathology laboratory is sometimes physician may take samples during the surgery or physician may send biopsies to the pathology during surgery. So it is based on the requirement. For example, if we take Mohs surgery where physician will take the sample, as soon as he take the sample, he will test the pathology. Next one is cytology laboratory. So cytology laboratory is a medical facility where doctors can take samples from your body. So basically in cytology laboratory, most of the time, physician will examine the fluid samples. So, using the swabs, here physician will take the fluid samples and they will use it for the disease process. So, after obtaining the fluid samples as a biopsy, physician will check under the microscope in order to find any type of infection in the provided sample. So next one is what is CLIA. So CLIA stands for Clinical Laboratory Improvement Amendments. So under CLIA, healthcare providers obtain permission from the CMS to perform sample tests such as urine pregnancy test in their office. These tests are known as CLIA-waived test and are identified with the modifier QW. So for example, if you go to any type of interview, they will ask you what is about CLIA. So CLIA stands for Clinical Laboratory Improvement Amendments. So if you have the license of CLIA, you can perform small tests like urine pregnancy test in the physician's office. So in order to do these tests, physician needs to have the CLIA license. So for CLIA waiver test, we will use modifier QW. So these are the surgical pathology and uh, like laboratory CPT coding sections. So using all these, we need to learn our surgical pathology and laboratory section. So now I have provided three samples here, three sample scenarios. So here I am going to help you to find an answer for the first one. So if you want to learn surgery coding, please code remaining two scenarios and post it in the comment section so that I can provide you with the correct answer. So what is our first scenario? Doctor performed an intraoperative consultation on a bile duct tumor requiring frozen section and cytological evaluation to a bladder tumor. How would you report his professional service? So basically here what happens? This is a intraoperative like consultation, means during the operation physician has performed the consultation. So as it is a consultation, we need to check in the consultation in the CPT index. So if you check consultation in the CPT index, it will show you clinical pathology, inpatient, interprofessional, like that. So if you see here, surgical pathology, intraoperative. So based on our scenario, physician has performed intraoperative consultation. So we need to check here 88329, 88331 88334. So we will check 88331 and 88334 in the book. So if we check 88331, basically physician has performed one frozen section as well as one cytological examination. So for two tumor samples. So here our answer is 88331 for frozen section, 88 like this one 88334 for cytological examination. So if we check the guideline here, we need to append 88334 in conjunction with 88331 and 88333. So if we check here, so first one is tissue black with frozen section for one specimen, and next one is cytological examination for another specimen. So here we need to code 88331 and 88334. So this, if you see here, bile duct tumor and bladder tumor. So both are different types of tumors and from the different locations, and also technique is also different. Like first one is frozen section, next one is cytological evaluation. So as we have learned, frozen section is like taking the tissue sample. Cytological evaluation is for like using the fluid, physician will evaluate the sample. So here we need to code two codes like 88331 and 88334. I hope so this session is very helpful for you. So try to use your CPT book and find answer for these two remaining scenarios. So if you mention in the comment section of this video, I will provide the correct answers. So thank you guys. Thanks for watching this episode. Please watch, learn, subscribe, comment and share. Happy coding guys.